Welcome, welcome. Welcome to my new system of fun, learn, and earn. So, today's topic is gangrene. So, what exactly is the gangrene? Gangrene is basically the necrosis with putrefaction of the body tissues. So, what exactly is the cause? Main cause of gangrene is when the nutrition, oxygen is not going to the tissues, and tissues first undergoes anaerobic respiration, and ultimately these tissue die. So when the death of the tissue occurs, so two things can occur in that case. So if superadded infection is there, the result will be different. If superadded infection is not there, then the result will be different. When the superadded infection is there and there is lot of necrosis with skip lesions, the gangrene is known as wet gangrene, as in case of diabetes mellitus. Because in diabetes, the good culture medium is there in the tissues because of dead tissues, high blood sugar concentration. So these are the two factors that lead on to wet gangrene, as well as there is involvement of both veins and arteries in case of diabetes. But in case of dry gangrene, when there is only the arterial supply is decreasing slowly and slowly, and there is no added super infection over the dead tissues. So in that case, tissues become dead, dry, shriveled, and mummified. So ultimately, when this dead shriveled tissue shut off from the normal tissue, it is known as auto amputation. So there is basic two difference, and you can say the wet gangrene is more dangerous as compared to the dry gangrene. Let's dive into the mind map. So definition is necrosis with putrefaction, and as you know, in both cases, either it is a dry gangrene or wet gangrene, there is obstruction to the nutritional supply of the tissues as well as the oxygen supply. So, falling arterial obstruction, dry gangrene without any superadded infection. So, when saprophytic organisms are present in the dead tissue, they produce gas, they also produce bad smell, and this kind of gangrene is common in diabetics and it is known as wet gangrene. So what are the various causes of gangrene? In whatever may be the cause, ultimately that cause lead on to the decrease or complete obstruction of the blood supply. So loss of blood supply is the main cause in case of gangrene. So that blood supply loss may be because of any reason. That may be your thermal or physical trauma to the limb, extreme cold exposure that causes the vasospasm, and if this vasospasm remains for a longer duration, that can lead on to the gangrene. Then frostbite and trench foot, as in the cold exposure with moisture, that is trench foot, and the frostbite as occurs over the exposed part like your fingers, nose, lips. Then comes the chemical trauma. So this chemical trauma is intra-arterial drugs like thiopentane. So these are generally what happens by the accidental injection of thiopentane. It also causes the vasospasm. Ergot preparation, they also cause the vasospasm. Carbolic acid, it causes the direct destruction of the tissue where it is applied on the body surface. Burns and scalds. So burns and scalds ultimately they cause the tissue damage along with the damage to the supplying vessels. So ultimately what happens, the tissue that has already been damaged by the heat is further damaged by the compromised supply to that tissues. Then irradiation. Irradiation also cause your vascular supply compromise to the tissues. So let's close these nodes. So causes in vascular. So in vascular there may be involvement of the arterial or venous disease. In case of mainly the venous disease, that is the commonest disease is the atherosclerosis of the old age, and it mainly involves the larger vessels like aorta, both iliac vessels and femoral vessels. So other common disease is also known that can cause the dry gangrene, and it involves the medium to smaller vessels is the Buerger's disease, that is also known as thromboangiitis obliterans. So then next cause is the traumatic cause. Whatever is the cause of trauma, ultimately that trauma will lead on to compromise of the blood supply to the tissue. So strangulated hernia, when there is hernial neck, that causes a constriction over the gut loops or the omentum. So that will cause the compromise of the blood supply to the strangulated or stuck in the ring of the hernia. So that gut loop or the omentum ultimately will undergoes necrosis because of ischemia. Intimal flap avascularity. When we do the flap surgery, in case of plastic surgery, we are moving flap with the artery to some other place. So what happens during that movement, sometimes stretching or maybe some other reason, supply to that flap is damaged. So when that flap is supply to that flap is damaged, so ultimately the flap will undergo ischemic necrosis, and ultimately the gangrene of that flap will occur. It will blacken and it will cause damage to the tissues. And then infection, in any kind of infection, that will lead on to the thrombosis of the vessels, small vessels which are supplying to the that organ. In case of gangrenous appendicitis, the supply to the tip goes from the base of the appendix. So when at the base of the appendix there are lymph nodes which gets enlarged, there is edema, and ultimately what happens, there is and sometimes thrombosis of the vessels also occurs. So that will cause the necrosis and ultimately the gangrene of the tip of the appendix or maybe whole of the appendix. Then occurs a gas gangrene. So any kind of wet gangrene when it is infected with Clostridium perfringens organism. So these are the gram positive organism. So these cause formation of gas in the tissues, and you can easily feel the crepitus when we press the tissue, and on x-ray we can find out the black dots just like very fluffy shadows are there in the subcutaneous tissue and the muscles. So that can easily be recognized that the patient is having gas gangrene. So what are the various types? We have already discussed dry type and the wet type of the gangrene. Prognosis of dry gangrene is always better than the wet gangrene, and we should do all the measures to convert the wet gangrene into the dry gangrene. So what are the clinical features? Clinical features of the gangrene, basically, as you can make out, because of the ischemia to the tissues. So in case of dry gangrene, organ become the organs which are involved, mainly the limbs and the digits. So these are mainly exposed to the trauma, exposed to the extreme of the temperature, exposed to burns, heat, everything. So in case of dry gangrene, the organ becomes dry, shriveled, and it is a localized gangrene, not as with in case of your wet gangrene where the lot of area is involved, and sometimes the proximal skip lesions are also there. So those skip lesions, that means those lesions which are present just proximal to the site of injury, site of gangrene. So those skip lesions may be missed during the amputation. If we amputate the part at this part, skip lesions are present here. So that means this area is also damaged. So that should always be taken care of before doing any kind of surgery in case of wet gangrene. So line of demarcation is also present in case of dry gangrene, which is absent in case of wet gangrene. So what exactly is the line of demarcation? There is clear cut line between the dead tissue, that is the black tissue, and the living tissue. So there is no clear cut line of demarcation between the dead tissue and the live tissue in case of your wet gangrene. So dead tissue and the live tissue in case of wet gangrene, these are separated by the septic ulceration or the blister formation in case of your wet gangrene. So now let's come to wet gangrene. In wet gangrene, most of the time both vessels are involved, arteries as well as veins, as in case of diabetes mellitus. Diabetes mellitus is one most common cause for wet gangrene. So it involves both arteries and veins. Then there is excess of blood sugar in the tissues. So both act synergistically and they also promote the growth of bacteria in the dead tissue. So initially there is severe pain of ischemia. As we know that any part where there is less supply, that causes ischemia, and that ischemia will cause severe pain, as in case of your cardiac problem also. So that heart attack, that will cause myocardial infarction. So that is mainly because of the ischemia to the heart muscle that causes the pain. So wherever there is ischemia, there will be ischemic pain, and ultimately there will be necrosis of the tissue. When the necrosis occurs, tissue becomes dead. Along with the high blood sugar, it will lead on to growth of the organism and ultimately septicemia. So in case of wet gangrene, infection is present, blisters are also there, putrefaction of the tissue along with the involvement of tissues with the Clostridium perfringens, and that causes the gas formation. Ultimately gas gangrene can also be there. So in case of dry gangrene, the gangrene is limited to the distal part, and there is clear cut line of demarcation between the dead tissue and the live tissue. But in case of wet gangrene, there is a vague line of demarcation. You cannot basically define that at this line this is the dead tissue and this line this is the live tissue. So even if at this point we can make out that some demarcation is there, if we see more proximally, we find that skip lesions are also there at the proximal part. So we have to do the amputation at this level. Otherwise, what will happen? We do the amputation here, skip lesions are present here, and after few days we find that this part is also going into gangrenous changes. We have to do the amputation more proximally to save the life of the patient. So there is no clear cut line of demarcation and proximal skip lesions are also present. So what are the various investigations that we can do in case of gangrene? Let me close this note and this also. fold the node. So investigation, not much investigation, routine investigation that we have to look for complete blood count, blood sugar. If the patient is diabetic, then we can also do HbA1c to make out what exactly is the average sugar patient is maintaining for the last 3 months. So all the main investigations are routine investigation that we do. If patient is having some coexisting disease, that we have to do the test for that. Specific tests that are related to the gangrene that can make out whether the tissue is having some kind of arterial problem or the venous problem. So that is the color Doppler, that is the commonest investigation that we perform in case of gangrenous limb. So that tells us about whether the arterial supply to the part which is going into gangrenous changes, whether it is a compromised, decreased or totally absent. If it is absent, it is because of some thrombus or because of generalized vascular disease. So arteriography generally we do mainly when we have to perform some vascular bypass surgery. Otherwise the role of arteriography is not of much use. So that arteriography we can also use by the conventional method. We can also CT arteriography and MR angiography we can also do. So what are the general measures we have to do in case of gangrenous changes? So as we know, all these gangrenous changes are mainly because of changes in the blood supply of the tissues. So every measure that we can do to increase the blood supply to that organ we have to do. Whether we have to prevent the spasm, that is exposure to the that is cold, we may have to give vasodilator drugs, we may have to prevent the blood sugar going very high. So control of the diabetes, cardiac arrhythmias that can also lead on to what? Embolism. So thrombus form in the heart and that can dislodge from there and can lodge into some distal organs or maybe into the limb. That can cause your gangrene. So we have to correct the ischemia to increase the oxygen supply with the existing supply to that organ. IV antibiotics to cover gram positive, gram negative as well as anaerobes, specifically when the patient is having diabetes mellitus. Limb exposure to air, so that in case of wet gangrene, it should be converted into dry gangrene. We have to take every measures to convert the wet gangrene to dry gangrene. So dry gangrene and wet to dry gangrene is the main aim. So exploratory laparotomy may be required when we find that there is gangrenous changes in case of strangulated hernia. So to save the life of the patient, we may have to remove that gangrenous part of the gut and do the re-anastomosis of the healthy areas and repair the hernia. So one thing you must be very careful that whenever you find that strangulation has taken place and the gangrene is there in the gut, and when you are performing the exploratory laparotomy, so whenever we try to repair the hernia, we should not put mesh in such cases, because the chances of mesh becoming infected are very high. So that should not be done. We just have to anatomically approximate the layers of the abdominal wall and close that with pressure bandage. So what exactly is the treatment of the gangrene? Not much about the treatment. main aim is to save the limb of the patient, part of the body which is undergoing gangrenous changes. So, in case of dry gangrene, only that part is involved, tip is involved. We can simply, if it is totally dry, we can leave it as such and let it drop spontaneously. That we call auto amputation. The main thing is that we have to maintain it dry. We should not make it wet. So if they find that patient will not be able to maintain it wet, a patient is also having some other problems, better to do the conservative surgery and remove that dead part. So we have to do all the measures to increase the blood supply to that organ. That may be your bypass surgery, that may be vasodilator drugs that can increase the flow, or we can also prevent the exposure to the close that is cold that is causing the vasospasm. So measures to improve the blood supply, and the amputation of the part is mainly when the tissues are undergoing gangrenous changes, and that to the wet gangrene. In wet gangrene, the chances of patient undergoing into septicemia and ultimately into multi-organ failure are very high. So in that cases, if it is required, conservative amputation of the part should be done as soon as possible after looking for all the skip lesions, so that we should not have to do again the re-amputation of the proximal part that we have left with skip lesions. So in case of traumatic gangrene, we have to remove the dead tissues which are present. In case of wet gangrene, if it is spreading, then we have to do early amputation, looking for the skip lesions just proximal to the skip lesions. In case of gas gangrene also, we have to do antibiotics, broad spectrum antibiotics, and along with that we may have to give some other treatment like your oxygen therapy, or we can also give some immunoglobulins for gas gangrene, and also we have to do early amputation if patient is not responding to any measures. Thank you very much.